Hello, it's Rebecca Kelly, nurse practitioner at AIYANA.aesthetics, and this is Tuesday Talk, all about Botox misconceptions. So I wanted to kind of dive in a little bit and talk to you about Botox, Dysport, Xeomin. All of them are very similar medications used to treat wrinkles. They basically, what we like to call them, is a wrinkle relaxer. And there are so many misconceptions out there in regards to this type of medication and how it's used. And I just kind of wanted to clear the air and get some information out there for you. So there are a bunch of misconceptions about Botox or Dysport or any of the same. So let's just dive right in. So the first one is that Botox is toxic. What we know Botox to be known as is botulism. A lot of people will say, well, isn't it derived from botulism? It's actually derived from Clostridium botulinum, which is, it naturally occurs in the environment, and it's an inactive enzyme. Or organism. It's inactive, it occurs in the natural environment. So when injected, it is not like injecting botulism, as we know of, that can cause a severe reaction and even death. So it's not toxic. And in fact, it has been studied, Botox has actually been studied more than ibuprofen, and it's also been around since around the 1980s. So we know a lot about this product, and it's gone through rigorous testing, tons of studies, so it is very safe. The second misconception I wanted to talk about is a lot of people are worried that Botox is going to make them look frozen. So when they say frozen, basically that you can't make an expression. So as you can see, I'm talking right now and I do have Botox, but I still am able to make expressions. I'm still able to scowl when I get mad at my kids and look excited, and I still have wrinkles around my eyes, so my smile lines are still there. So when somebody is worried about being frozen with Botox, usually that is the injector that is overdosing the patient. So just like with any medication, it comes in different dosages, and as a nurse injector or provider, we are looking at the most, at least in my practice, the most natural result for our patients. And with that means that we don't want to overdose them. And everybody is different. And even you as the patient will be different depending on which medication we're using. Are we using Botox, Dysport, Xeomin, Jena, whatever we're going to use. But also, as you age, those wrinkles can get deeper and the lines can get more ingrained or more static, meaning they would stay there. And so we have to sometimes increase the dosage. But again, it's never to make you look frozen or to not allow you to have those expressions when you're talking and smiling. So again, that is the injector that is causing that issue. It is not the actual medication or Botox or Dysport. So the third misconception about Botox or Dysport is that it can erase all your wrinkles. Everything will go away. So when I have patients come in and I do my initial consult, we talk about this because I always want to point out that at rest, do you have any wrinkles that are just there? A lot of people will notice the scowl line wrinkle or, two scowl lines, the 11s. Some people will notice wrinkles on the forehead that are just there without having to raise your eyebrows or make, a mad face. They're there. So those are what we call static wrinkles, meaning that they are there without movement. Dynamic wrinkles are the ones that when you raise your eyebrows, you get the lines, or when you scowl, or, with the crow's feet, when you're smiling, those are the dynamic wrinkles. Dynamic wrinkles, we can treat them all day with Botox or Dysport, and it will soften them and it will make it so that you can't see them anymore. But those static wrinkles, those ones that are there without the expression, they are harder to treat. And I always like to tell people, if you come in with static wrinkles, it is going to take multiple Botox or Dysport treatments before we can get rid of them. Also doing, skincare and chemical peels, microneedling, all those things are going to help decrease those wrinkles, but it's going to take time because the skin has to catch up. The skin has now been making that wrinkle or that fold for years, and just by Botoxing it, it's not going to get rid of it. It's going to not allow you to make that movement as deep as you used to be able to, but it's not going to get rid of it. So I hope you learned something today, and make sure that you like, comment, subscribe. We appreciate you, and we hope to see you at AIYANA soon.